Hi friends, welcome you all to a new episode of Spine Connect. Today I wanted to discuss a very good success story. Hi sir, today we have Dr. Cervical with us and he is a pioneer in a lot of spine surgeries. Hi, namaste. I just wanted to discuss about one case. I had met the patient, she was very happy with the recovery, she is a teacher and she was discussing but not able to explain what was done. She said that there was a problem in her neck and you had some keyhole surgery.
Yes, okay.
That is something we wanted to discuss.
Yeah, thank you, sir. I think it's a very important topic and we should make awareness about this, that we actually have started doing the endoscopic spine surgery for the cervical spine, the neck, what the region we talk about. And patients where they are not settling with pain in the neck, the pain goes from neck to the arm, goes to the hand, they start getting weakness in the hand or upper extremity, and the disc is paracentral or on the side where the nerve is going, that's the foraminal area. We used to normally do the surgery from the front, and it used to be quite an invasive surgery where we used to do surgery from the windpipe, food pipe and some blood vessels which were supplied to the brain, and we used to go in between those delicate areas. But it was a very standard surgery called as ACDF and very successful. But nowadays, with the advent of this endoscopic where it's a keyhole, we do the surgery and we can remove this problem without putting any implants, and they are called as endoscopic spinal decompression surgeries for disc, and they are very classical surgeries. They were described quite a long ago, and we have done the microscopic assisted cervical foraminectomies, the tubular MED, the microendoscopic surgeries, but nowadays we are doing really keyhole endoscopic spine, and patients are extremely happy with this. Yeah.
I wanted to know what was the case of this, what she was suffering through, and are there any more patients?
Yeah, so this is a very important thing. She is a teacher and she used to work in a nearby district where she used to write it by her hand on the board for the students. She was a higher standard teacher, and she used to get a lot of pain in the right side, and when she used to write it on the board, she used to feel better. She did not realize why it's so, and when she went to the local doctors, they did her MRI and it was found out to be a slip disc of C5-6 level, and which was pressing the nerve. And she took some medicine, she took some rest. She was wearing the belt for around 3 to 4 months, but her pain was not settling, and then she started getting severe pain and difficulty using this hand, and this was some amount of weakness in the hand when she was referred to us. At that time we evaluated, we did her dynamic x-rays, the MRI scan, and we explained that she needs surgery. We can do both the surgeries, but this surgery was opted by her. We normally give all the options to the patient, and we explain all the pros and cons. She opted for a minimally invasive endoscopic cervical discectomy operation.
And in these cases, what all the recovery timings are? A lot of people are very worried about.
They are becoming popular because the recovery time is extremely less. She went back to school in around 20-22 days. We had told her that around 1 month or 4 to 6 weeks she should take it easy. A lot of people are going back to work in 15 days. I will not promise to all, but as per your pain intensity, most of them will join. Around 3 to 4 weeks is our telling, but as you start feeling better, you actually can start doing the things.
I think so. That's a really great story that we are able to hear it from you.
No, and she's very happy, and she got her mother also to show it to us, who is suffering with a cervical spondylosis, and we told you don't need any operation. And most of them don't need operation. That's the important thing. Those who are not getting better with persistent pain and with clinico-radiological signs of a problem needs to be addressed.
Thank you so much, sir. Thank you for your time, and we'd like to hear more stories so that people are aware about what all problems are going on, and anything people would like to comment and ask about their problem.
Thank you so much for your inquisitiveness and curiosity for understanding the problem. And this surgery is specially called as UBE, the unilateral bipod endoscopic cervical spine operation. UBE endoscopic surgery. Thank you.
Thank you.